benvenuti ad una nuova intervista del nostro canale YouTube Linea al Benessere. Oggi parleremo di tiroide e abbiamo il piacere e l'onore di avere con noi la dottoressa RULA GOUSSOUS, una famosa endocrinologa a livello mondiale di origine della Giordania, ma che esercita la sua professione medica a Farmington Hills, nel Michigan, negli Stati Uniti d'America. È specializzata in particolare nel cancro della tiroide e nelle patologie tiroidee in generale, nella sindrome dell'ovaio policistico, nella dislipidemia e nel diabete. Fa parte della commissione di valutazione degli endocrinologi della Giordania. È segretaria e tesoriera dell'Associazione Americana di Endocrinologi Clinici della sezione della Giordania ed è un membro fondatore della Società della Sindrome dell'Ovaio Policistico della Giordania. Partecipa frequentemente a incontri internazionali di medicina, conferenze e programmi di formazione ed è un membro attivo sia come partecipante che come relatrice di associazioni, gruppi e consigli consultivi, sia a livello locale che internazionale. Good morning, Dr. Rula. How are you?
Good morning. How are you? I'm okay. Thank you so much.
Okay. Thank you for being with us today. Thank you.
Thank you for inviting me. My pleasure. Thank you so much.
Okay, let's start the interview.
Of course.
Okay, what is the thyroid and what does it do? Why is it so important?
Well, the thyroid gland, it's an endocrine gland that is located here in front of the neck, anterior in the neck, just below the Adam's apple, just below this cartilage is called thyroid cartilage. It is one of the largest glands and it weighs maybe 10 to 20 grams. It's very important, this thyroid gland. It's essential and crucial because it controls the brain development of the infants and the somatic development and the growth of the infants. In adults, it controls all metabolism, all metabolic activity, and all protein synthesis. You know, the thyroid gland virtually regulates and controls every organ system. You know, it's important for the heart, for the gastrointestinal tract. It's important for the menstrual period. It's important for the hair, for the skin, for the body temperature. You know, we say when the thyroid knocks, the heart listens. The thyroid is very important. And the most important thing is that it is, if the infant or a baby is born without a thyroid gland, they could develop a mental retardation. So it is a treatable cause of mental retardation in babies and children. It's very crucial.
Okay. And so, doctor, how to know when you have a problem with the thyroid? What are the signs and symptoms?
Okay. The signs and the symptoms. Now, you know, of course, you develop signs and symptoms, and after you develop the signs and symptoms, you confirm this by a blood test and sometimes by an image, an ultrasound of the thyroid or a scan of the thyroid. Now, for example, if the thyroid is not working well, it's underactive, because you know it is what controls the body. You can develop some symptoms like feeling very cold, weight gain, feeling very fatigued, losing the hair, severe constipation. When you come to the doctor complaining of change in the voice, the voice being very, very hoarse, for example, you complain of the eyes being puffy, of the face puffiness. When the doctor, examines the patient, he can find, for example, that the thyroid might be a bit enlarged, that there is some pericardial effusion. For example, that is if you have an underactive thyroid. But for example, if the thyroid is working really, really overworking and working really more than needed, the patient would come in complaining of severe weight loss, though he or she is eating very well. They will complain of bulging of the eyes. You will notice rapid heartbeats, shaking of the hands, sweating, feeling very hot, feeling very tired, and so forth. These are some of the symptoms and the signs of thyroid.
Well, and at what age should you have a checkup for your thyroid?
You know, doctor, we need to check all babies when they're born. You know, second day after delivery, okay? Because
Yes.
as I said, if the baby is born without a thyroid gland, you treat right away and you prevent mental retardation. Okay? Now, the other important thing is that you have to screen pregnant women, maybe in the first trimester. Some say this should not be universal, but we are advocating that every pregnant woman should be screened, okay?
Okay.
Now, adults, for example, non-pregnant adults, we really trying to screen everyone, but because, you know, the thyroid is a very cheap test. But if it's not possible, then we can screen, for example, someone who has a family history of thyroid. For example, if your sister has a thyroid, if your brother has a thyroid,
It's
if you
genetic.
take certain medications,
Okay.
it runs in the family.
Okay.
Not necessarily genetics, but sometimes the cousins, sometimes the aunts or the grandmothers. If you have another autoimmune thyroid disease, like for example, you know, vitiligo or any other diseases, we screen. If someone has Down syndrome, we check for the thyroid. Some patients, if they take a medication for the heart called amiodarone, they have to be screened. Or if they take a medication which is called alpha interferon for the multiple sclerosis, they have to be screened. You know, it's a long list, but I mean, if it is good to have it as a universal screening test.
Okay, perfect. And so the last question, how to resolve the problem? What type of cures exist today? What kinds of research are you doing on these topics?
Okay, so let me first talk about, just to say about the problems. Now, if the thyroid is not working, okay, we say that this is an underactive thyroid, and we say this is hypothyroidism.
Yes.
The most common cause is iodine deficiency or Hashimoto's. If the thyroid is overactive and working a lot, we say this is hyperthyroidism, and this is called Graves' disease. Now, sometimes you can have just a thyroid enlargement, and this is called the goiter. In other cases, you can have an inflammation of the thyroid, and this is called thyroiditis. And of course, we can have thyroid cancer. Now, the treatment is very easy. If the thyroid is not working well, we replace it with its hormones, with the medication that is very common, that has been out there for 117 years, that's very cheap, called thyroxine.
Yes.
If the thyroid is overactive, and you know, the patients have bulging of their eyes, we can give medications, we can give iodine therapy, or we can do surgery. Okay, nothing really magical. The treatment has been out there, has been the same forever. And if there's a goiter, a thyroid enlargement, we take it out by surgery. If there's a thyroid cancer, we also take it out by surgery, and we follow it by iodine therapy. You know, the test for the thyroid, the medications for the thyroid, they're so old. They have not changed forever. The way we diagnose the thyroid, it's the same.
Okay.
We don't really do any research because, you know, everything is known, but we are trying to find out, for example, if the levels of the thyroid should be changed, because we think that the levels should not be very wide, you know, the normal levels. We're trying to advocate universal screening, you know, simple things like that. The studies now are ongoing to see if we need to operate on everyone with thyroid cancer, or we can just watch it. You know, if certain medications cause thyroid problems, we need to study them. Simple things, nothing really major, you know?
Yes, I know. Well, thank you for your time and the insight that you have given us. Thank you very much.
Thank you so much for allowing me to participate today. Thank you, my dear, my pleasure.
Hopefully we can do another interview in the future if you want.
I will be delighted. Of course, I would love to do that. Hopefully we can make it.
So, till the next time, doctor.
Till the next time. Thank
Noi
you.
ci vediamo alla prossima intervista del nostro canale YouTube. Un saluto dalla dottoressa Manuela e da Linea al Benessere. A presto.